Hello, AlphaFlo community. This is Kelly Calabrese, and today I'm here with Dr. Mike Moore. Dr. Mike, thanks so much for being with us.
Certainly.
Yeah, we're glad you're here. So you're with Southside Animal Hospital in Corpus Christi. Can you tell us a little bit about what you do there at your practice?
Well, I'm primarily a small animal veterinarian, but I do see a lot of military working dogs and border patrol dogs and pets of military personnel because I'm in Corpus and we have a big base here, and then we have a lot of detachments for the border patrol and so forth. So,
Thank you for that. Yeah, we definitely want to talk more about that. We appreciate the service that you offer there for the military dogs for sure. So yeah, we'd love to talk more about that. Tell us, how did you first hear about AlphaFlo?
My drug salesman had contacted me and told me that they were going to start carrying it. And actually, the Alpha Covetress contacted me and wanted to see if they could help me with some of my service dogs, especially the ones that got older, injured, and to try to improve their longevity, increase their longevity, and improve their lives. I do help a lot of, or some retired working dogs, and so they were wanting to try to help me with that community of veterans and their service animals.
Wow, that is fantastic. We're really honored that they came to you and that you're known for doing that and that you have a heart to do that. Just really, really means a lot. Very, very special. Can you give us a couple examples of cases where you've used AlphaFlo?
Yes, recently, well, actually several months ago, I had a 13-year-old retired border patrol dog that came in. He had a TPLO 3 or 4 years ago, and he was having problems with his good knee because he was favoring the bad one so much, and the dog was, the guy had adopted the dog, and they were actually considering letting the dog go because he had been on some NSAIDs and gabapentin and wasn't really helping very much, and he was having a very difficult time getting around. So I injected both of his knees with AlphaFlo and then gave him an IV infusion, and it was, and I gave him some steroids too and took him off the NSAIDs for short term. But he has, the owner has, and handler has said that he has felt like he's gotten multiple years back on this dog's life. It has improved his existence so much. He is just like elated because he loves this dog. I had about 3 months ago, I had a medically retired veteran bring in his 13-year-old service dog who had back surgery. We'd done back surgery through our 501c3 through Hanks and Eli's fund about 3 or 4 years ago. And periodically he's had a lot of back issues, and he was having some real difficult time getting around. So I just gave him an IV infusion, and the dog's been doing very, very well. I had another dog that came in about 4 months ago. It was a overweight shepherd that had a TPLO 3 or 4 years prior, and the owners they brought him in to put the dog down because he was so miserable and couldn't get up, or it was so difficult for him that it was really bothering them. So I just gave him an IV infusion and gave him some steroids short term, and the dog's been doing very well. And this one was a blood pet that they just weren't ready to turn loose. And I had some in the refrigerator that AlphaFlo had sent me, so I just mentioned to him, why don't we try this? And that dog has done very, very well. Another place we've been using it with, I think, some really great success is in TPLOs at the time of surgery. And now I don't have a whole lot of numbers on this, but there was 2 dogs that we gave it to at the time of surgery. And the follow-up on those dogs was to take sutures out. I mean, we injected the joints at that time. And those dogs have had no follow-up. They're not on NSAIDs or anything else. The dogs are both doing very, very well. And that's been for about the last 3 months or so. I had another dog that had one, belonged to 2 policemen here in town. It was their pet. And I gave that dog an IV infusion. And about 2 weeks after surgery, that dog's been doing very, very well. In reviewing some of the others that have had TPLOs recently in our practice, a number of them have had to have follow-ups because swelling in the knee, and this is maybe about 3 or 4 dogs, swelling in the knee, no, well, 3 dogs, and just not doing as well. They didn't get the AlphaFlo at all. And again, that's not a large number, but the indications are that if you give it at the time or shortly after surgery, especially, I think it would be more helpful given in the joint at the time of surgery, that those dogs just the few that I've done seem to respond very well because of the healing benefits from the AlphaFlo.
Wow, that is significant. For the pet owners who don't know what TPLO is, can you tell us what that is?
Yeah, it's a procedure where they go in and when you tear an anterior cruciate, it's a specific procedure for going in. They have to go in and cut part of the bone and reshape the tibial plateau, put it at a different angle so that the knee stays in place. It's a pretty significant surgery for the animals. Most dogs that tear their cruciates will tear the opposite, their remaining cruciate sometime in the not too distant future. Once they've torn that one, because they put so much stress on the good one, trying to alleviate alleviate the pain in the knee that's had the surgery. And I just think that the healing potential for the AlphaFlo really will hopefully be interesting to see over time if we see a reduction in the tears in the other cruciate. I would be real interested over time because the dogs are doing so well. The owners tell me they are running around like they never had surgery. And anybody that's had knee surgery, and this is shortly after they've had knee surgery, if you've ever had knee surgery, you tend to, when I tore my ACL, my good knee within a few months became my bad knee because I was a jogger and I was jogging 5 miles a day. 5 miles a day within 4 weeks after I tore my ACL. And so my good knee sooner than later actually became my worst knee. So you tend to, take pressure off the bad one and that put more pressure on the good one, which you have a tendency to injure the other one. Who knows? That may be partially genetics, but it may be also I'm sure partially because you're compensating by taking pressure off the one that you've injured.
That makes sense. So in your experience, how has AlphaFlo compared to things you were using before?
Well, all we had were, we could do, I'd use polyglycan on some, putting it in to try to restore the hyaluronic acid and so forth in the knees, and with some success for sure, and steroid injections in the knee. But over time, if you can get that thing to heal more effectively with allograft from the AlphaFlo, to me, that's a much better way than covering up, because most of the other treatments are just covering up the pain. And they do reduce inflammation to some degree, but I would think if you could get that need to heal, the damaged tissue to heal with a product like AlphaFlo, I think that's much more advantageous than giving products that are just covering up the injury.
I agree.